Intermediate level intervention, as I spoken earlier, is a bit more comprehensive than basic level intervention, but it still can be delivered in a clinic session. Perhaps it will take a little bit more time. So I would urge you to actually set aside a clinic visit specifically addressing the smoking cessation. So the 5 A's are ask, advise, assess, assist, and arrange. And I have given the reference for this, and you should look into this reference. So what is the step 1? Step 1 is about asking. Ask every patient regarding their use of tobacco. Make tobacco use history as important as allergy history. So I'll urge you to have a prompt in your case note that will quickly remind you to ask about the smoking history in that particular patient. So the phrase that we can, or question that we can ask, have you ever been a smoker or used other tobacco products? Do you use tobacco now? And if it is, how much? You can ask about the number of cigarettes they smoke and for how many years. The step 2 is about advice. Advices to the patient should be personal, direct, unambiguous, and strong. And I want to reiterate that it is not a very generic recommendation. It is actually personal, focused, direct, and it has to be strong and delivered unambiguously, meaning there should not be any hesitation on the part of the doctor. I think quitting smoking is very important for you because of your asthma. Much of your asthma exacerbation are clearly related to your smoking. So it is very personal. It's directed to that individual. Step 3 is assess. Assess the smoking history, current level of nicotine dependence, whether he or she is willing to quit, and if she is or she is not, then we have to identify what are the reasons for his not quitting. And also we have to come up with a definite time frame, and it is important to set a date by which that person should quit, and we can actually take opportune moments such as Ramadan, marriage, a pregnancy, or a vacation time to set the date for quitting. We should also explore previous attempt in quitting and reasons for failure. Many smokers may actually tried quitting smoking before, but they have failed for various reasons. And if we know why they have failed, then we can address those issues subsequently. So some of the questions that we can ask: have you ever tried to cut back on or quit smoking? Are you willing to quit smoking now? What keeps you from quitting? How soon after getting up in the morning do you smoke? So the last question actually help you to assess the tobacco dependence among the smoker. Step 4 is about assisting. We can assist to quit line. Many countries there is a smoking cessation program. These are free, and we should get their help, and we should anticipate and prepare for challenges. We should get help from the family, the spouse, the children, the father, mother, and so on. It is important to removal of the triggers. So at the initiation process, ask the person to stay away from smokers so that it does not trigger him to smoke immediately again. And we should also get help from the peers, and advise the person to mix with the non-smoker friend during this phase. The step 5 is the arrange a follow-up. Quitting is never a one-off option. A person who quits smoking, especially at the earlier stage, he or she will remain vulnerable to start smoking again. Success of quitting is higher if a firm quit by date is arranged. As I mentioned earlier, we can take opportune time such as Ramadan time, marriage, vacation, or pregnancy. And during the follow-up, we should inquire about the success and difficulty, encourage continuation, and emphasize with the problem and symptoms.